Hello, everyone. I miss seeing you all, and first and foremost, thank you for taking the time out of your busy life um, to let me share my capstone project with you. It's a little awkward giving a presentation via social media, or the internet, or any other electronic means, and please forgive me for wearing headphones. I wanted you to be able to hear me a little bit more clearly and drown out some background noise. Um, so let's begin. So, as many of you know, when I first started working at Homewood, I also decided to go back to school, straight out of PTA school actually, to get my bachelor's degree. And part of my bachelor's degree program requires me to complete a capstone project. Now, when I was pondering ideas for what I could possibly do for my project, I knew I wanted it to be something meaningful, something that I could give back, something that I could show that I really care about Homewood and the residents. When I started working in the outpatient clinic, I noticed that the caseload for our patients in the outpatient clinic started to dwindle down uh, before the coronavirus, of course. So I knew I wanted to do something to get more patients in the clinic. I wanted to market therapy. I wanted to increase our caseload. And I wanted to help everybody that I could. So, what I did, I chose Angela as my mentor. Um, After all, it was her who started and has been the foundation of the outpatient clinic, and I thought that she would have a lot of wisdom and could provide me with a lot of guidance through this project. So, her and I sat down and we were talking and trying to figure out what we could possibly do. She had mentioned the fact that years ago, the therapy staff used to provide 15 to 20-minute in services on various topics from is joint replacement right for me, cardiopulmonary, fall prevention, urinary incontinence, everything under the sun. So I thought that it would be an awesome idea um, if we could create videos that we could play over Homewood's TV channel or even have the residents access from YouTube, um, which coincidentally became what I ideally had to do anyways because of the coronavirus. So I sat down and started scheming up my plan. And what I had originally wanted to do was incorporate all of the therapy team. I was going to ask if we could create 15 or 20-minute videos for each of us to have kind of our own little expertise, so to say, and to put ourselves out there to get the residents to really connect with us and get to know us better. With the coronavirus, I was unable to do that, so I had to change my whole idea. I cried and cried and cried for days and nights, wondering what in the world I was going to do. I talked to my professor, and she had said that my idea is a great one, which I thought so as well, and that this would be something that I could continue in the future after the coronavirus died down, or whatever the case may be. It's a starting point, and it's something that I would like to implement in the facility. So what I did was think about a topic that I could reach out to the most people possible. Um, and urinary incontinence stuck out to me. This topic is something that I really had no idea anything about, to be honest, other than the day that we had in school. I'd never had any other experience on urinary incontinence, and I didn't know the first thing about it, really. So I chose that topic so that this would be a learning process for myself as well. So as I started planning for my project on urinary incontinence, I had to decide what information was most important to get out to the residents at Homewood. I had to think about how I could engage them. I also had to think about what if this pandemic lasts for longer than any of us are aware of? Um, what can I do to help them in the interim? What can I do now? So, as I began making the video, of course, I was not able to use my coworkers as I had wanted to do originally. I wanted to really engage with the residents a little bit more. So I chose to do a PowerPoint video where I gave a voiceover presentation. Now, I wanted to present the facts, but I also wanted to deliver my information in a way that the residents would understand. So you'll notice here in a little bit that my video contains a lot of evidence-based information, but when I speak about it, I relay it to the residents in a way that they can understand. My long-term goal for this entire project was to obviously increase our caseload. I wanted to be able to present different topics and keep track of how many new referrals we would get based on if they saw the video or not. But I also wanted to give the residents something that, whether or not they chose to come to therapy, they could use to help out. So what I would like to see in the future is that if we all could work together to create individual videos, we can educate the patients, or prospective patients rather, on different topics and give them a little taste of what therapy would be like. Give them something that they can use now until they get the referral from their doctor to come see us. Here in just a minute, I'm going to be sharing with you the video that I created, and I want you to give me your honest feedback. I want ideas on how we can actually make this work, how we can all chip in um, and fulfill our social responsibility of marketing our profession. And most of all, I want to bring back our caseload. We all want to work, we all love the residents, and I'm hoping that this is something that could really kick off, that Homewood could use, the therapy department could use. Once we get the topics down, we would save the videos. They would be there forever, and all they would need to do is submit them to the Wellness Center. Gretchen has been very helpful with educating me and sharing info with me about Homewood's televised channel as well as their YouTube sources and everything else, and has fully agreed to take any of our videos and share them with the residents. And even in the future, we could make a video collaboration with the wellness department, because Gretchen had also mentioned to me that she often gets questions from the residents who participate in the wellness activities about why they can't join this group or why they can't join that group, and the milestones that they have to meet before they're able to participate in the activities that they want to. So again, thank you for taking your time. I really appreciate this. And in the email I sent you, there is an attachment for an evaluation. If you wouldn't mind giving me your honest feedback, get those back to me at your earliest convenience, and enjoy my video. Thank you. Hello everyone, my name is Alicia Sweeney and I'm a physical therapist assistant here at Homewood of Crumlin Farms. Today we're going to be peeking at a topic that most people feel uncomfortable talking about. In fact, most people are often so uncomfortable discussing this topic that it unfortunately goes undiagnosed and untreated, leaving thousands of people to suffer with both social and emotional issues. Urinary incontinence affects more than 13 million people in the United States in both the male and female populations and can occur at any age. These numbers are only from the reported and treated cases. However, so many people do not discuss urinary issues with their physicians because they are embarrassed or ashamed. My hope today is to provide you with information about urinary incontinence and alleviate any fear you may have about coming out with any issues you may be experiencing. Bringing awareness to the utilization of physical therapy services as an efficient urinary incontinence treatment option that is proven most effective for all types of urine leakage issues can help you get out there and enjoy your life again. You are not in this alone. We are here to help. To feel comfortable talking about urinary incontinence, it is, first, important to understand what incontinence is, the ways that it can be caused, and how the body responds to changes that may lead up to urine leakage. Today, we're going to take a look at a few things that will help to eliminate any uncertainties or discomfort when talking about and addressing urinary incontinence with healthcare professionals. First, I want to share with you what urinary incontinence is, including the different types, the muscles involved, and common factors that affect both men and women. Then we will look at all treatment options for urinary incontinence that you could potentially be presented with. Lastly, I want to present the most successful urinary incontinence treatment, which is physical therapy, and ways in which your therapy team here at Homewood can help and provide you with simple exercises that can get you started on the right path today. So, what is urinary incontinence, or often referred to as UI? UI is defined by the International Incontinence Society as an involuntary loss of urine, which is objectively a demonstrable social and hygienic problem. Urinary incontinence affects approximately 20 million people in the United States, and the economic cost of UI exceeds more than $16 billion per year. Did you know that community dwelling women spend more than $750 out of pocket per year for urinary incontinence management, including briefs and cleansing products? 44 to 50% of women aged 40 to 65 are affected by urinary incontinence, and more alarming, 75% of women over the age of 75 are affected. You will notice that men are affected slightly less. 11% of men aged 60 to 64 are affected by urinary incontinence, and 31% of older men are affected. However, as we will see later, the men that are most affected suffer from prostatic complications. There are many different classifications of urinary incontinence. Let's take a look at a few of the most common. Urge incontinence is the involuntary contraction of your bladder muscles. Many people with this type of urinary incontinence experience a strong, sudden urge to urinate and are unable to hold their urine long enough to make it to the restroom. Urge incontinence goes hand in hand with neurogenic incontinence, as somewhere along the line the nervous system is not functioning correctly and the signals to and from the bladder and brain do not function properly. Many neurological disorders such as diabetes, Alzheimer's disease, Parkinson's disease, multiple sclerosis, and those who have had a stroke suffer from this type of incontinence. Next, we have stress incontinence. This is the most common of all urinary incontinence in women of all ages, as women endure childbirth, which creates a large amount of strain to the pelvic floor and will make these muscles weak. Stress incontinence occurs when urine leaks from the urethra as a result of increased intra-abdominal pressure being placed on the bladder. Now, what is intra-abdominal pressure, you may ask? This occurs anytime we sneeze, cough, laugh, or lift heavy objects. As we bear down on our abdomen for any reason, the contents of our torso are compressed, and to no surprise, these organs place pressure on your bladder the same way that it would if we took our hand and pushed down firmly on a ball or a balloon. When the pelvic floor muscles are weak and are unable to keep the urethra closed, urine leaks out. There is also what is known as overflow incontinence. In this instance, the urethra is obstructed, preventing the bladder from emptying completely or resulting in a small streamline of urine that never feels complete. Because of this, the bladder is always full, therefore constant pressure is being placed on the urethra and the urine sphincter, leading to urine leak. This type of incontinence is more prevalent in men with enlarged prostates due to the anatomy and location of the prostate. People with spinal cord injuries and diabetes are also subjected to this type of urinary incontinence, as the signals in the nervous system may be compromised and not functioning correctly, causing the inability of the pelvic floor muscles to relax to allow for urine output. Stress incontinence and urge incontinence can occur at the same time. This is called mixed incontinence. This usually occurs as we age. The body's muscles lose overall tone, and the nervous system slowly begins to decline in function, resulting in increased susceptibility to urine loss and leakage. Lastly, functional incontinence is a form of urinary incontinence where people have normal bladder function but are unable to make it to the restroom before having an accident. The elderly population is most affected by this type of urinary incontinence as it begins to get harder to move around or move as quickly as we once used to, due to such things as arthritis, physical obstacles in our living environment, and even movement disorders. Did you know that younger populations can also demonstrate this type of incontinence as a result of an orthopedic injury or dysfunction, such as a broken leg? Did you know that muscles of the pelvic floor actually are responsible for the conscious control of urine output? There are several muscle layers that make up the pelvic floor. While I certainly don't expect you to know all the muscles or their specific function, it is important that you think of your pelvic floor as a mini trampoline that has tension but is still able to move. This trampoline supports vital organs such as your bowel, bladder, and for women, your uterus. The pelvic floor is made up of different types of fibers called fast twitch and slow twitch fibers. Slow twitch fibers are responsible for the overall tone of the pelvic floor, which keeps constant tension unconsciously, allowing for organ support and normal continence of the bowel and bladder. Fast twitch fibers provide strong, quick contractions, such as when you cough or sneeze. This allows for control of urine output during increased intra-abdominal pressure. Most important, the pelvic floor is consciously controlled, therefore it can be trained much like all other muscles in our body. Now that you understand how and why urinary incontinence occurs, let's take a look at how it affects both men and women of all ages. Urinary incontinence prevalence in women is much greater than men, as women bear children and are more susceptible to disease processes that affect urine control. However, men are still affected by several of the same processes that women are and should not be excluded. In fact, a study in the Indian Journal of Urology noted that out of 757 male Medicare patients that underwent a prostatectomy, 41% stated that they were incontinent after surgery. Even more alarming is the fact that only 6 to 7% of this population sought treatment for their incontinence. Looking at each sex, menopause causes a decrease in estrogen production in the woman, which consequently results in weakened muscles throughout the body. Childbirth also causes the pelvic floor muscles to become stretched and weakened, and the full uterus places added stress on the bladder and pelvic floor. Widening of the hips in preparation for childbirth also causes the pelvic floor muscles to become stretched, as these muscles all attach to the pelvis. Women have historically greater prevalence in neurological disease processes such as Alzheimer's disease and multiple sclerosis. While prostatic diagnoses are the main cause of urinary incontinence in men, they are also more susceptible to the development of Parkinson's disease, putting them at an increased risk for urinary incontinence. Ultimately, both men and women are susceptible to urinary incontinence as we age. The muscles in our bodies slowly begin to lose function and require extra training to maintain tone. Many other complications can lead to incontinence in both men and women, such as a stroke, diabetes, spinal cord injuries, and obesity. Lifestyles can even contribute to urinary incontinence, such as those who have lifted heavy objects over a long period of time and those who participate in high impact exercise routines. Often, many people seek treatment for urinary incontinence in the form of pharmaceutical or surgical interventions. However, many of these options result in adverse effects, revision or correction surgeries, and decreased compliance. Many surgical, invasive, and pharmaceutical options are available for the treatment of urinary incontinence. Often, surgical interventions are unavoidable for the treatment of prostate cancer or other pelvic floor injuries. To get a better understanding of these medications and procedures, it is always best to have this conversation with your primary care doctor. Pharmaceuticals can help the bladder empty more fully during urination and can also help tighten the muscles and lessen the amount of leakage. Even though there is strong evidence for their use, evidence also shows that the compliance rates for urinary incontinence programs that involve medications is low due to the adverse effects. More invasive procedures, including injections that can be administered that thicken the area around the urethra to help close the bladder opening. But more likely than not, these injections will need to be repeated to show any improvement, which wastes valuable time and money. Also, there are medical devices such as a urethral insert that can be used by women and other external appliances that can be used by men, such as a penile clamp and catheter. Again, these types of interventions increase the likelihood of infection and discomfort. Another invasive procedure that may be used requires the use of electrical stimulation, which requires inserting metal probes into either the spine or the area surrounding the bladder. Moving on to surgical procedures. Surgical procedures include the placement of an artificial urinary sphincter and fascial slings. Artificial sphincter placement has been shown beneficial to reduce stress urinary incontinence in men, however, comes with great problems related to its use. Patients are often unable to manage the mechanism correctly. There is a risk for urethral atrophy, loss of fluid from the mechanism, cuff erosion, and the mechanical failure of the device. These complications require a revision surgery to correct. Fascial slings provide implanted support to the pelvic floor. There are many different types for men and women, with the male type usually being attached differently to allow for increased blood flow to avoid atrophy and erosion. With any surgery, you have increased risks. In a study found in the Indian Journal of Urology, almost all patients required at least one adjustment of the sling performed under anesthesia. Several patients required the sling to be removed due to infection. Intraoperative bladder perforation occurred in several patients, and pain and discomfort was very common for all patients receiving a sling implant. None of these options sound fun and should always be used as a last resort. While many medicines, surgeries, and invasive procedures are effective at reducing incontinence, often these interventions are unsuccessful or a reduction of benefit is found due to adverse medication effects. Therefore, treatment is discontinued and incontinence continues to take over your everyday life. All evidence-based literature states that pharmaceutical and surgical interventions should only occur secondary to failure of conservative treatments. The number one first-line treatment of urinary incontinence should be pelvic floor strengthening and physical therapy. Why physical therapy, you may ask? According to research, a weak pelvic floor is the most common cause of pelvic dysfunctions, including urinary incontinence of all types. As professionals in body movement and function, physical therapists will help control external factors that affect urine output, increase pelvic floor muscle strength, retrain nerves that have lost function, and focus on restoring functional activities that may have been hindered due to urinary incontinence. Pelvic floor physical therapy is a program of functional retraining to improve pelvic floor muscle strength, endurance, power, and relaxation in patients with pelvic floor dysfunction. According to recent evidence-based research, pelvic floor physical therapy has shown very positive outcomes. One article states, based on the available evidence, pelvic floor physical therapy, PFPT, with or without supplemental modalities can improve or cure symptoms of urinary incontinence. Another article states that these interventions reduce the amount and frequency of urine loss and the impact of UI on quality of life. And lastly, there's high quality evidence that shows that pelvic floor muscle therapy was more than 5 times as effective as no active treatment for improving urinary incontinence. Physical therapy for the pelvic floor is much more than strengthening exercises, but yes, we address those too. But what we really do is educate and guide you through a lifelong process of maintaining urine control. For example, did you know that certain food and beverages can stimulate your bladder and cause you to urinate more frequently? As physical therapists, we can assist you with using and maintaining a voiding diary to help track your individual incontinence episodes and times that you frequent the restroom. We target specific functional limitations such as leaking urine when lifting or coughing and train the body to perform optimally during these tasks. Interaction with the therapy team gives you the added support you need to participate in the program to see results. And last but not least, by coming to therapy, you are not only helping yourself, but you are helping shape the medical care necessary for others just like you suffering through urinary incontinence. How is this possible? By attending therapy, therapists report positive outcomes utilizing various techniques. With increased positive results comes funding and advanced medical treatment for urinary incontinence. If you are aware that you have urinary incontinence or are questioning whether or not you may have urinary incontinence, you should begin a simple home exercise program. These few simple and fun exercises can be done in the comfort of your home and can be a great preventative measure and are great for increasing core and back strength, which also will help improve your balance. The first exercise you can complete is a routine of diaphragmatic breathing. Diaphragmatic breathing is important to master when completing all exercises, especially those exercises or activities that require heavy lifting or large amounts of exertion. Remember, as we talked about earlier, increased intra-abdominal pressure places increased pressure on your bladder, possibly causing stress incontinence. Well, surprisingly, the diaphragm is also a muscle which can be trained and strengthened. Diaphragmatic breathing activates the inner core muscles, which ultimately reduces intra-abdominal pressure and activates the supportive muscles from the bottom up to help stop urine leaks. First, you will start in a position that is comfortable for you. You can lay on your back or your side or even sit in a chair. If you are sitting in a chair, it is important that you maintain good posture so that your rib cage is placed right over your hips. Take a deep breath in through your nose, focusing on the lower rib cage expanding, and your stomach should inflate. This should feel like a much deeper breath than normal. Then blow out through your mouth slowly. You should notice that your rib cage and stomach deflate. Take several minutes a day to practice this type of deep breathing. Not only does diaphragmatic breathing help increase the strength of the core, it has been proven that if you're able to slow down your breathing to 6 to 10 breaths per minute, you are also improving the ability to manage physical and mental stress and help balance your autonomic nervous system. Once you master diaphragmatic breathing, you can begin to incorporate pelvic tilts. To complete these, lay on your back. Flex your hips and knees while keeping your feet flat on the surface you are laying on. Next, take a deep breath in using the diaphragmatic breathing techniques. As you exhale, pull your belly button in and bring your pelvic bone up towards your head. When doing this, think of your pelvis as a bowl and you are wanting to tip the bowl backwards towards your spine to pour out its contents. Hold this position for 2 to 4 seconds and then relax while taking your next inhale. Complete this 15 times, 3 times a day. Next, we will begin incorporating Kegel exercises into your program. Completing a Kegel correctly can often be challenging. When you complete a Kegel, you will use the muscles that you use to stop the flow of urine. I recommend sitting on the toilet the next time you are using the restroom and practice stopping the flow of urine so that you know when you are activating your muscles correctly before performing these exercises. For women, this contraction will feel like you're drawing up your vagina and tightening the bladder and anal sphincters. Men also feel this same way, except these contractions in males cause the penis to move slightly. After you can identify these muscles, lay on your back as if completing a pelvic tilt. As I discussed earlier, the pelvic floor muscles contain two different functional fibers, each requiring different training to increase strength. On odd days of the week, squeeze the pelvic floor muscles, holding them tightly for a slow count of 3 to 10 seconds, slowly relaxing your muscles. Complete this for a total of 5 to 10 strong contractions. On these days, you can progress to incorporating Kegels into your pelvic tilts. To do this, simply prepare for a pelvic tilt, but before tilting the pelvis, contract and hold a Kegel, relaxing the pelvic tilt and Kegel at the same time. But don't forget to incorporate your breathing techniques. On even days, squeeze the pelvic floor with strong, quick contractions of 20 to 50 times, then relax and repeat 2 to 4 times. You may notice that you are unable to complete this many contractions, but over time and with practice, these repetitions will increase as the muscles become stronger. While these exercises are very basic techniques used to treat urinary incontinence, it is still very important for you to seek a physical therapy evaluation so that we can help you even further. Our body is an integrated system with everything working in response to everything else. One of the big ways I've seen this chain reaction is in ankle injuries. A stiffness in the ankle prevents proper ankle rotation, which keeps the hip from rotating properly. Hip rotation is the key for pelvic floor function because hip muscles help tell the pelvic floor to fire. We can identify these deformities and help you treat them. Understanding urinary incontinence plays a big role in eliminating the fear of discussing your symptoms with your physician or other medical professionals. You should not suffer from the emotionally debilitating effects of urinary incontinence, and we are here to help you. Remember, you are not alone, as millions of others just like you deal with the various issues of urinary incontinence daily. If you watched this video and thought that you may have symptoms, please, at minimum, begin the home exercise program included today. Even if you do not yet have symptoms, technology is allowing for people to live longer than before, and the prevalence for all urinary incontinence will only increase. Prepare yourself and take action now and regain control of when you have to go. Thank you for watching, and I'll see you soon.